You know, Kasese is very unique in terms of the geographical location. One, we border the DRC. Almost every other complicated infection is imported from the DRC. And of course also, we are just between national parks. Queen Elizabeth National Park on the side, and then Mount Rwenzori National Park on the upper side. MPOX began around July 2024. Our usual program of screening at the border caught up with a patient that had a rash, and so we suspected. Samples were taken off from the patient and eventually confirmed positive. Kasese is the first district that reported the first case in this current outbreak of MPOX in the district, being able to respond to MPOX using resources that have been provided by UNICEF.
When you look at the recent outbreak of the MPOX in Kasese District, children were affected, most especially where the home that suspect or the victim was staying. It means there was a lot of discrimination from the community. As probation and welfare, with the support of different partners, UNICEF inclusive, we came in to ensure that the rights of these children are protected. UNICEF has not stopped there. They have also supported us in the coordination mechanism. So they played a part in sensitizing the community to understand what MPOX is.
Twesiimye nnyo okutuweereza tools ezogera ku MPOX, kuba luli nga tetunaba zifuna twanyumizanga abantu MPOX kikyeri nga abamu tebakitwala serious. Kati twebaza UNICEF okutuleetera ebyo ebipande, kuba twatandika obitimba ng'abantu okulabako bongera okwekuuma n'okubeera serious ku kirwadde kino.
The fundings that we've received, most of it had gone into the area of risk communication, ensuring that our masses, our people are being informed of the risk of monkeypox. And finally, the coordination pillar is very critical, ensuring that all these pillars are functioning normally and are doing well to be able to combat the outbreak of monkeypox.
We formed ourselves into structures up to the village level, community level. The main function of these structures was to do mobilization and sensitization of the community. So we have had these structures all over the district. We trained the cultural leaders.
We were trained by the district about the talking points about the MPOX. When we were trained, we were able to access the cultural leader, Senka Charles Bwera, was given talking points that we was able to pronounce them over the radios.
And we have also used the media to propagate the information, because we trained most of our local journalists around, and they have been helping us to pass on the information through. We have four giant FM radio stations. We have used them.
We are able to reach the communities across the eastern DRCs through radio talk shows. We are able to interact with them, give them information about health, about MPOX, and if we can enlighten the community, give them information, we can be sure that we are going to manage and be able to interrupt transmission in time.
We appreciate UNICEF for the support that they gave us, because whatever funds were received actually have gone to these activities to ensure that we have been able to combat and control the spread of monkeypox in the Kasese District.